Hi everyone, this is Nurse Ryan, and today we're going to be talking about the drug Semaglutide, also known by the brand name Ozempic. You can use the timestamps in the video description to jump ahead. Ozempic is a brand of an injectable form of semaglutide, which is often used to decrease blood glucose in patients with type 2 diabetes. First, let's go over the basics of how Ozempic works. Now, this bit is a bit of a mouthful, but stay with me and I promise it sounds harder than it really is. Ozempic belongs to the glucagon-like peptide-1 receptor agonist drug classification, and thankfully this can be shortened to just a GLP-1 agonist. But still, what does that mean? Now, normally when you eat, your body secretes the hormone called GLP-1, which does a few things to help regulate your blood sugar level. First, GLP-1 increases the secretion of insulin from the pancreas, and insulin is a hormone that helps to lower blood glucose levels. Next, GLP-1 can also decrease glucagon production. Glucagon is a hormone that basically does the opposite of insulin. Glucagon raises blood glucose levels. Another thing GLP-1 does is increase how full you feel after eating, which helps to reduce food intake and often helps in, again, lowering blood glucose levels. Finally, GLP-1 can also slow down gastric emptying or slow down digestion, which also helps in, you guessed it, lowering blood glucose levels. So as you can see, this hormone called GLP-1 that is produced in the body naturally has many ways to lower blood glucose levels. Now back to Ozempic, which is a GLP-1 agonist. We now know what the GLP-1 part does, but what is an agonist? Well, an agonist is simply a substance that mimics the actions of a neurotransmitter or hormone when it binds to a specific receptor. And in our case, this receptor will be a GLP-1 receptor. So Ozempic mimics GLP-1 and binds to the GLP-1 receptors in the body, essentially tricking the body into lowering blood glucose levels in all those different ways that we mentioned. It is also thought to contribute to weight loss due to its effect of increasing how full you feel after eating, thereby decreasing the amount of food intake. Ozempic is most often used in the treatment of type 2 diabetes, alongside lifestyle changes such as diet and exercise, and also other anti-diabetic drugs such as metformin. The goal of Ozempic is to lower blood glucose levels. Ozempic can also be used for chronic weight management in adults with obesity or who are overweight, with at least one weight-related condition such as hypertension or high blood pressure, type 2 diabetes, or high cholesterol. Ozempic is also used to reduce the risk of major cardiovascular events such as heart attacks or strokes in adults with known cardiovascular disease and either obesity or who are overweight. Ozempic binds well to albumin in the blood, making it more difficult for your kidneys to metabolize and get rid of it from blood circulation. This is actually beneficial in most cases because it allows Ozempic to be administered only once weekly. This makes Ozempic a long-acting semaglutide. Dosing is typically as follows: a 0.25 mg injection once a week for at least 4 weeks before increasing it. If the dose needs to be increased after the first 4 weeks because the blood sugar remains elevated, then it gets bumped up to a 0.5 mg injection once a week, again for at least another 4 weeks before increasing it. And the same thing can happen again, increasing to 1 mg once a week, and finally after another 4 weeks, if needed, it can be increased to a maximum of 2 mg once a week. The most common possible side effects of Ozempic are nausea, vomiting, diarrhea, abdominal pain, and constipation. One of the main side effects to look out for is hypoglycemia, or abnormally low blood glucose levels. Hypoglycemia may present as dizziness, weakness, confusion or irritability, hunger, headache, and more. There are many other possible side effects of Ozempic, primarily inflammation of the pancreas or pancreatitis, which may present as upper abdominal pain, which may radiate to the back, gallbladder issues, which may also present as upper abdominal pain, clay-colored stool, fever, and more, changes in vision, kidney problems, and more. An important consideration is to remember that Ozempic itself is not actually insulin, though it does help increase the secretion of insulin. When injecting Ozempic, always inject subcutaneously in areas of fatty tissue, such as the abdomen, thigh, or upper rear arms, and to rotate the site of injection regularly. Inject Ozempic at the same time each day, and Ozempic can be taken with or without food. Ozempic should be kept in the fridge, and after first use, Ozempic pens can only be kept for 56 days at room temperature or in the refrigerator. Avoid taking Ozempic if you have pancreatitis, diabetic retinopathy, hypoglycemia, acute kidney or gallbladder injury, are pregnant or breastfeeding, and more. It is not known if Ozempic injections are safe and effective for use in people under the age of 18 years. And that's about it for the basics of Ozempic. If this video has helped you out, please consider leaving a like and subscribe. I would really appreciate it. If you have any questions or would like me to review a specific drug or topic, please let me know in the comments, and thanks for watching.